especially when physical distancing is impossible. And so the way the mask works is it acts like a barrier between the person's mouth and nose from the outside world, so it stops those droplets from spreading when you're talking, when you're yelling, when you're singing, when you're sneezing or coughing. There are certain situations where it would be really good to wear a mask. The first one is you should wear a mask if you are sick. So as we know, COVID-19 is spread through droplets from a sick person's mouth and nose. And by wearing that mask, you are stopping those droplets from leaving your mouth area, which will protect other people in your home. This does not replace that you should be staying home when you're sick. It just helps protect other people in your house. The next situation where it would be really good to wear a mask is if you're taking care of someone who is sick. And so that just helps you actually protect yourself from those droplets being spread by the sick person to hopefully be able to take care of them longer and healthier. The last situation is if you are wearing a mask when you're healthy, when you're not sure if you'll be able to physically distance when you're out in public. So that could be at many different situations, like at the grocery store, even in the health center, in the band office, things like that. You can wear a non-medical mask for this and help provide protection for the public and for the community. There are two types of masks. The first one is medical, and it usually looks something like this. It can also be called a surgical mask. These are usually reserved for healthcare workers and people caring for someone sick with COVID-19. This does offer some protection for the healthcare worker if they use it in conjunction with a shield or a gown to help present all those different ways the virus can spread. This is actually called a homemade mask or a fabric mask, and these are just used by the general public for those who choose to help protect other people around them. And so our public health officer is recommending that we use these masks when we're not able to keep a 2-meter distance from others when those people are not inside your bubble. And so these are a great resource as well. So the best practices when you're using a mask is to make sure you're washing your hands before you're putting it on, before you're taking it off, and after you're taking it off. It's really important that we always keep clean hands and that we only touch our face with clean hands. The fit should be tight but comfortable so that you don't have to adjust it once it's on your face. It should be clean, dry, and undamaged. We don't want to share it with anyone else. We only wear it when we're going to be within 2 meters of others. Cloth masks should be washed after every use and stored in a bag, and medical masks can be disposed after every use. It is important to note that some people with certain medical conditions and who are under a certain age, it is not safe to wear a mask, and so to not have judgments for people who aren't wearing masks or who are wearing masks, it's important to note that people under 2 years old should not be wearing masks due to the inability to breathe. There are other preventative measures which are so effective in stopping the spread of COVID, like hand washing, staying 2 meters away from others, disinfecting surfaces in your home, and those should be used as well as masks if possible. It's important to continue to act like COVID-19 is in the community because it could be at any time. So if you experience any respiratory-like symptoms or flu-like symptoms, please call the Splatsin Health Center at 250-838-9538. And if it's after hours, you can call the HealthLink BC line at 811. Thank you.